We're located in Córdoba, Argentina. It's the second biggest city in Argentina. This is a 45-year-old hospital. We have 72 licensed beds, this type of boutique hospital. We receive more than 8.7 thousand admissions every year. And last year, during COVID also, we received more than 75,000 visits. We have more than 250 physicians, and our name is Instituto Modelo de Cardiología. That's why we have a lot of cardiologists, and our cardiology team is the main specialty that we have. Our philosophy is that first comes the patient, second comes the patient, third comes the patient, and the patient's family. And we strive for personalized care and also teamwork. And then the number one goal is improving patient care. So our lean journey started in 2012. We were committed to process improvement in the hospital, and it was a key factor for us to be able to obtain different certifications for quality and care. So the first one was in 2014 when we accredited by in Argentina Instituto Técnico para la Acreditación de Establecimientos de Salud, which is actually supported by ISQA from Europe, same as ISQA supports also Joint Commission. In 2017, we were the first center in South America actually to be accredited by the American College of Cardiology and the American Heart Association. There was a lot of work that we had to do, and it was fundamental need for us to be able to improve all our processes to be able to qualify for this type of accreditation. In 2018, we were the first ones outside the US to be actually accredited by the American College of Cardiology in heart failure patients and treatment. And actually in 2019, we received the award at the American College of Cardiology Quality Summit, the first place for quality improvement for our work in heart failure patients. That same year, we were actually awarded as an international certification as an international center of excellence. So how did we start our journey? The first thing that we had to do was to have the board buy-in. So we started with an institution evaluation. We started to assess the leaders, how they actually were engaged with the future, how we were performing at that time, and then what we expected to be, where we wanted to expect it to be, and how we were going to be able to approach that. So we started to start working with different, improving the experience of patients and also waste reduction. How did we do that? Actually working in model cells. Hospitals have a lot of other things. We have a restaurant, actually, we have housekeeping, we have, a lot of different areas, outpatient visits. And we decided to work on one project where we had physicians involved, which was the cardiac rehabilitation program, and then other support areas to have also physicians buy in. It's very difficult to convince at the beginning physicians that lean is very important, not only devices or different medication, the different type of diagnosis. We need to actually know how we're delivering care and how is the process and how are we going to be able to improve and make it safe for the patients. So we started working a lot in leaders education. And one of the main things we did workshops with leaders, Gemba walks with experts, and we invited people from different parts of the world. We invited people from the US, from Brazil, from Switzerland, to come visit us, actually do Gemba walks with us, and also do workshops. We also did a deep dive into physicians education. So we had the opportunity to take physicians to the Ohio State University in Columbus, Ohio in the US in 2016. We took those leaders to be able to be trained in lean and operational excellence at the Academy for Excellence in Healthcare. And we actually loved the program, so we ended up bringing the program to Argentina in 2018, where we trained a lot of more our leaders, not only physicians, but leaders in other areas. And the most important thing that we are committed to is to share our knowledge. So we did the first Argentina Healthcare Lean Summit, and we invited many companies, many hospitals to participate, to spread the knowledge throughout the country, to make it better for every patient in every hospital. And we also do a lot of lean in-company trainings and also sharing. So we have our in-company day where we share A3s and we work and do workshops like 5S workshops and when Gemba works. So which were the challenges actually that we actually faced when we were we started our lean journey? The first thing was the lack of leadership commitment. They were in status quo, okay? So there was not, so happy to start a journey. The second thing is we had resistance, from some leaders and also staff to adopt the culture. One of the reasons for that, ignorance of the benefit. Also, we had a lack of employment engagement. There were skepticism and also low interest due to fear to unknown, and also fear to job elimination by optimizing processes and reducing steps. Something that didn't happen, actually. We were able to accommodate different employees at different areas that were needed. Lack of collaborative problem solving. Okay, so physician leaders were selected basically on how much knowledge they have based on in medicine, but not how many skills they had as best leaders and managing change. So it was difficult to maintain them on the left side of the A3, and they started jumping into solutions really fast. So we had to work with them on not only working on the root cause analysis more, but thinking also systemically. So acting locally at your department, but impacting systemically in the best way you can. Another challenge that we had also was several jobs in different organizations. So several physicians here in the hospital work for other hospitals. So we had to work with them because they have different cultures. And based on that, education and knowledge gap is one of the major problems we have. There's no lean thinking education at School of Medicine, nursing, or other related areas with healthcare. You do have for engineer, but not for healthcare. So another challenge that we had was there was a lack of lean thinking training experts here in Argentina at that time. So our countermeasures were working on improvement, requires continuous education. So we started, like as mentioned before, doing a lot of Gembas, also learning from others, courses, workshops, and also focus mainly on leadership education for them to be able to train their people and to guide them correctly. And sharing results, like I mentioned, internally and externally were very, very important. So you have here me visiting Japan in 2018, learning from Isao Yoshino, which was the mentor of John Shook. You have here also visiting Professor Ferro, who was the leader that worked also with John Shook, Dan Jones, and also Jim Womack. And he visited our institution, doing Gemba walks, revising all the boards. This is the pharmacy. These are the leaders, the leader of the pediatrician department, and having him here share with us and also challenge our lean journey. This is our group being trained in the US. You have all physicians here, leaders from different departments in Ohio State in the US, and then you have the academy here in Argentina doing training for other different departments. And this is a sample of our lean day where we do workshops. This is a workshop for 5S. And you have the IT leader, the rehab program leader, you have nurses, physicians, biochemists, all working together. We share A3s more in a poster format because it's healthcare. We're more, thinking into posters and oral presentations. And you have also the important thing is that you have, for example, board members here participating. And this is how we share outside our world, in the rest of the country, trying to invite, different companies to join us, different hospitals to join us. You have here the board members at the front here supporting this initiative, and you have people from the US and also from different parts, from Brazil, from different parts of the world, also coming to share their knowledge. So a few words from our team. Our lean journey has taught us a new way of thinking and working, which has incredibly motivated us and has been fundamental for becoming an international center of excellence from the American College of Cardiology. Lean is leading us to eradicate variability and get the whole institution to perform the best we can 24/7. Lean has led multidisciplinary groups to discuss what is best for the patient. Lean culture is professionally and humanely uniting the whole institution as a team, and our work is impacting so many patients daily. And the lean culture gives us the certainty that every change that we're making is for the patient, who is the greatest beneficiary. So we, believe in the best way to predict the future is to create it. It was said by Abraham Lincoln many, many years ago. So thank you very much for your attention.